You're listening to The Dr. Shoup Show.
Critics love this show.
Let's get back to improving your life with exclusive information and consultation. Here's Dr. Randy Shoup.
Well, I know that a lot of people have accused me of having roughly the humor mentality of somebody that's a 7-year-old boy. But other than that, the joke has to do with something having a crack in it. And we're going to talk about, in dentistry, cracked teeth. And I will tell you, there are many things in dentistry that dentists absolutely hate to deal with. Cracked teeth is one of them. It is one of those esoteric, nobody has a definite, actually rock solid, proven way, double-blinded clinical trial study supporting this methodology is the best methodology to fix a crack in a tooth. Now, you wonder, how often do people get cracks in their teeth? And I will tell you that if you have silver amalgam fillings in your teeth, you have cracks in your teeth. I would almost bet the family farm that you can sit in my chair, and if you have silver fillings, particularly if you have older silver fillings, I would bet the family farm that I can take those silver fillings out and your teeth underneath those fillings will be riddled with fractures, because you and I have talked about this before. Silver fillings exhibit a phenomenon, and these amalgam restorations exhibit a phenomenon called creep. These restorations, the silver fillings grow, they get bigger, they expand. It's like having a glass milk bottle sitting on your porch in the middle of winter. The milk freezes, it expands, it either breaks or cracks the glass, or it shoots up out of the top as it freezes. That's what happens, except a amalgam silver filling is confined within the tooth, and it exerts all that pressure, and lo and behold, snap, the tooth cracks. So, dentists see fractures and cracks in teeth all the time. When I was in the clinic in Kenya, that was one of the number one things that I saw having happened to a certain group in the population. They have incredibly coarse diets. They really use and exercise their teeth something fierce. And they had numerous cracks on the outside of their teeth in the enamel. But when you started to really look closely, the cracks did not go down into the meat of the tooth, down into the dentin. And honestly, that's the way Mother Nature has designed teeth to be. The enamel of your tooth is really hard. The dentin, the meat of your tooth inside, is significantly softer than the outside, and it's flexible. It will move and bend and compress, and it's designed to dissipate off fractures. But you cut a big hole in a tooth, you put a bunch of silver stuff down in there, it changes all of the dynamics, and then teeth start to crack. You're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and we're talking about one of the things that makes dentists and patients crazy is cracks in your teeth. Now, when I got to the clinic in Kenya, I was amazed that they had a product there that is called Ribbond, R-I-B-B-O-N-D, Ribbond. It's made from a guy's company. He's out in Seattle, Washington, and he is just the coolest guy on the world. David Rudo is his name. He looks like Albert Einstein. And several years ago, when they invented Kevlar fibers, he thought, well, this stuff is awfully tough and durable. I bet I could do something dentally with it. And so he had these people design and figure out how to weave these little strips. They look like shoestrings on old-fashioned tennis shoes. Shoestrings were woven and they were flat, and you could see that they had this woven pattern. Ribbond looks like a layer of shoestrings off of a Converse All-Star tennis shoe. They're white. They're made out of Kevlar. They're incredibly durable. You have to have a special set of scissors in order to cut the stuff. And so you can, if you get down inside of a tooth, you can use these Kevlar fiber ribbons to literally lace across a fracture inside of a tooth, and it literally knits the tooth back together again. It is absolutely remarkable. And let's say you're a patient and you have a tooth that you cannot chew on. You can't bite on it. You can't chew on it. If you do soft stuff, it's not so bad. But boy, if you hunker down on a potato chip or hit some crusty bread just right, it will send you through the roof. I will bet you have a crack in your tooth. Now, most dentists today, how you're trained in dental school and what you just learned to do out in practice would get you in the chair and say, oh, you have a crack in your tooth. Your tooth needs a crown or a cap on it. You all know my feelings about crown and capping teeth all willy-nilly. It makes me absolutely insane. And so today's world, how we have technology, there is absolutely no reason to put a crown or a cap on your tooth, even if it has a fracture in it. And you heard it here from Uncle Randy. So if your dentist says, oh, your tooth has a crack in it, we must put a crown on it, have them call Uncle Randy. I will tell them, no, that's not the case. And so you're listening to the Dr. Randy Shoup Show. And so you're listening to the Dr. Randy Shoup Show. I am your host, Dr. Randy Shoup, and that's why you tune in, so that I can tell you these things that nobody else is going to tell you, and I can hopefully help you avoid having your tooth ground down to a nub and having a crown put on it. And instead, here's the alternative. Even if you have a crack in your tooth, pay attention, get out your pencil and paper. Here it comes. You want to clean out the old filling. You want to clean out all the crud and gooey stuff that's in there. And if the dentist sees a fracture down through the bottom of your tooth, here's what they do. You want to clean that out real thoroughly with the little air abrasion system that I have, kind of a miniature baby sandblaster, because it makes the surface of the tooth very, very porous. You want to then apply what we call bonding agent. Okay, let's think of James Bond. He's a bonding agent. A bonding agent is a form of glue that soaks into your tooth. Then we put a real thin layer of almost kind of, it's about the consistency of warm honey, tooth-colored filling material down on top of where the crack is. Then we take these little fibers and we cut them at exactly the right length that we need to cover the crack. We soak these fibers in the bonding agent, in the glue, okay? And then we squish it down on top of the crack, which has the kind of honey consistency tooth color, and that stuff comes up through the shoelace fibers, okay? And so it all becomes one giant continuous Kevlar reinforced patch over top of the fracture. So I hold that in place exactly where I want it to go, and my assistant takes one of the curing lights, the little lights, and she shines it down on this whole mat that I have laid across the bottom of the tooth, and it all instantly sets and hardens. It becomes one continuous mat. Now, what does this do? If the tooth wants to underload while you're chewing on it or grinding your teeth or doing something like that, if the tooth wants to flex, these Kevlar fibers then engage and start to move over top of each other and keep the crack from opening and closing. It, in essence, knits it back together. We use these Kevlar fibers underneath fillings. We use them underneath inlays and onlays. We had a lady in the office just recently who actually broke off the whole outside wall of her tooth. And with these Kevlar fibers, knowing the techniques that we know, we can literally rebuild an entire wall of somebody's tooth, and you don't have to have a crown. You don't have to have a cap. Now, If you try to fix these fractures without this ribbon fiber, you are destined to fail. They will all fail, and the patient will come back to the dentist and go, you told me I had a crack in my tooth, and my tooth still hurts when I chew on it. And they'll go, I told you so. You need to have a crown on there. No, you don't. It's because they didn't use these Kevlar reinforced fibers to reinforce the tooth to help heal up the fracture, and you would have then been fine. So you've heard it here that even with a fracture in your tooth, you do not have to have a crown or a cap. And you can have the same quality of dentistry that I did in the jungles of Kenya in a remote clinic serving the Maasai tribes people, because I've got the exact same stuff here. Isn't it amazing? It's a small world we live in.
You're listening to the Dr. Shoup Show. Exclusive insider info, audio, and video is online now at ddsradio.com.